I'm here year after year looking for innovation, and in particular, my interest is always in how do we prevent hypoglycemia.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with my friend Robert Oringer. We're on the floor of the American Diabetes Association annual scientific session. Sometimes I get that wrong, the SciSesh. And Robert, you are a T1D angel investor, as well as being a member of our T1D Moonshot Impact Board. You're seeing innovative companies here. I'm sure there's things that you're curious about. Maybe there's some gaps in what you're seeing that you'd like to see more of. So I want to dig into that. So start with just give me a quick flyover of what your experience is, kind of like what you bring to the table here.
Who I've been here, I think this is my 34th year, since 1990. And when I first came in 1990, I was on the other side of it. I was the entrepreneur, I was the startup, and I was finding my way. Originally, it was in the Lancet business for blood glucose monitoring. And now the years have passed and I'm here year after year looking for innovation. And in particular, my interest is always in how do we prevent hypoglycemia. For years and years, I was treating hypoglycemia.
Hypo is your passion.
Yeah, so for years, I was developing innovative products to treat hypoglycemia, mild and moderate, with glucose tabs, glucose gels, glucose drinks. And then I innovated and started a company and innovated rescue glucagon. But since 2015, my focus is really on how do we prevent it from happening, and companies that have little innovations can contribute towards that.
Let me just go back to what you said. You said 34 years of coming to the ADA.
I can't say that I've been here 34 straight years, but it has been 34 years. I've missed a year here or there. Maybe my kids were born when my two boys were diagnosed with type 1 diabetes, which came 7 years after 1990. It happened in 1997. There may have been a year or two or three where I might have missed, but I've been here for a long time.
So you were here before those two diagnoses. Yeah. How did that change just how you felt coming here and looking for those solutions?
When my two boys were diagnosed, I immersed myself. My wife and I immersed ourselves. And coming to the conference, I was in business. I was looking to network, to meet potential customers, to meet healthcare professionals, key opinion leaders, and I've made so many friends over so many years in the industry. So I'd say, I'm a dad of two boys with type 1 diabetes. We're philanthropic in the space, and we've immersed myself, Marla, and I in the business of diabetes.
I think you're a unique player here in that you're on the angel investment side, and yet you are incredibly passionate about impact. You're not just coming in saying who has a big exit coming, and acting like a typical VC. So what innovations are you seeing here that excite you? You said you were interested in actual cure. So what are you seeing?
I didn't say cure. I'm interested in cure, very interested in cure. But as an investor, I can have an impact on cure, but I can really have an impact on medical devices. And going back to what I'm really focused on is preventing hypoglycemia. As an example, yesterday at the Innovation Challenge, the ADA's Innovation Challenge, one of the T1D startup companies was one of the selected three winners, John Wilcox from Diatech. And John is working on preventing occlusions and having information about occlusions in infusion sets. So that is one innovation. It's one component of building systems to prevent hypoglycemia from occurring. Hypoglycemia, in his case, if it could prevent occlusions, it would prevent hyperglycemia. But sometimes when you have an occlusion, you might overtreat with insulin, trying to bring the glucose level down, and then you wind up in a rebound of low blood sugar. So each innovation is a step towards improving life until we have a cure.
What are your thoughts on bridging the gap from the startup world to just all the legacy players we see here? Oftentimes you see posters about brand new ideas, and it feels like there's a bit of a gap, a bit of a valley between them and the folks that have really millions of users, the Dexcoms of the world, and it can be hard to figure out, okay, where does this innovation plug into our current system?
You know, Dexcom's amazing because I watched Dexcom from the start. I watched Dexcom where accuracy wasn't there, but they kept improving and improving and improving year after year. I mean, Dexcom started, it was really an implantable sensor, and then it became a sensor you wore on your body. But I'll use it as an example. Within T1D Moonshot, we have several companies that have innovations with apps and software working with Dexcom data. So those companies are smaller innovations building upon an innovation that started, I think Dexcom, I don't know, maybe it was 2001, 2002, somewhere around there that I remember Dexcom showing up here. I'm not sure of the date, but I was already in it 12 years. And so I just watch, I love walking the exhibit hall. My two favorite things now coming the last 2 years are the Innovation Challenge and walking the exhibit hall. Going slowly, booth by booth, talking not necessarily to the big monstrous booths, but literally walking up to the tabletops where the innovators are.
I love that too. Have you done that yet? And did you meet anybody interesting?
I've done it, and I haven't had enough time to do it, and I'm going to dedicate more time today to do it. I'd say one innovation not in the T1D space is seeing scales, weight scales to measure lean muscle mass. As a result of the GLP-1s, people need to be sure to not lose lean muscle mass. This could come into our space of T1D when we have adjunctive therapy where people who are taking insulin will wind up, I hope, eventually being able to access the GLP-1s. But if we can have combination therapy of insulin plus GLP-1 or insulin plus SGLT2, these adjunctive therapies, well, particularly with GLP-1s, we have to watch for the loss of lean muscle mass. So there are innovations on the show floor in the area of scales.
Interesting. Okay, last question. You've been a really dynamic member of the T1D Moonshot Impact Board, really a proponent of the kind of collaboration that we believe in. Can you give us an example of a time when you've seen that community in action in terms of folks either helping each other or the board really leaning in and sort of the power of the collective being greater than the single?
I hear at the conference, it's unbelievable because there's a community of people. They know each other. They talk to each other. They're on conference calls. They're on teaching sessions. What are they called? Like class?
Master classes?
Yeah. Master classes, office hours. And then I wind up in conversations where some founders, transformers are hitting a wall on something or frustrated, and I understand from talking to him, they even have now back channel calls that they're having. They're talking to each other outside of those master classes. I think that's incredible. And if in my earliest years I had the benefit of that peer-to-peer connection, it would have been unbelievable. But we have it now here.
Well, Robert, I know every single member of that Moonshot is appreciative of your experience and the fact that you lean in on those calls. So I'm glad that you're here for a 34th time and that your passion is driving this.
It's only 34, but maybe somewhere in there.
I know, but I like to know that you've seen this society and this meeting evolve and change, and you've been a part of that and a catalyst for innovation. So I appreciate you.
Thank you very much. Thank you, Logan.